Although 1,586 out of 4,478 positive cases in the country have recovered, the country has been taken through a crash course on dealing with the pandemic, which has claimed 121 lives so far. However, in May 2020, coronavirus cases in Kenya were seen to rise steeply despite the severe preventive measures imposed by the government to contain the virus. However, on April the 22nd, Health Cabinet Secretary Mutahi Kagwe indicated that there were enough testing kits to achieve the set target, which is to conduct 250,000 tests by June, but so far, only 136,361 persons have been tested. Among the reasons making the target largely achievable is the limited number of testing kits and testing capacities in the private and government-owned laboratories.
Remember, we have been having a very big problem in the health sector. More specifically, the structures and the testing capacity that we are able to have. And if you look at how we have been doing it, we have been doing, for the first over 4 months, we were doing less than 1,000. And since then, now we have increased the number. We are doing between 2,000 to 3,000, which is a good indicator that we can grow. But this is not good enough. I think, I remember some time back, the ministry through the CS announced that we are able to do 30,000. So if we are able to do 30,000, where are we? I think after that we have taken more than 2 months. So we ought to have grown that capacity.
Healthcare workers have been in the front line every day inadequately protected, hoping that they will not go home infected and pass on the disease to their loved ones, and anticipating that the promised PPEs from the government will finally make their way to the clinics and hospitals they serve.
It should be noted that already we have a number of healthcare workers that have been infected in this country, owing to around now, last week we had 97, I think now we are rising to around 93. That's a very big number. So when you look at also on the safety of the healthcare workers and the provision of the PPEs, the personal protective equipment, I think you get to understand there have been a lot of cry about the healthcare workers not feeling sufficiently protected because of lack of training and also lack of enough PPEs for all of them.
On June 10th, the government launched protocols for home-based isolation and care, anticipating to discharge asymptomatic COVID-19 positive cases. But the big question is, do most Kenyans know the criteria for someone to be released for the home-based care procedures, medical monitoring, the referral system to health facilities should the need arise, as well as the criteria for determining recovery and community participation?
We have proposed for anyone to go and be said that they are having what we call home-based care, then you must be able to have healthcare workers, the public health officers, and the healthcare team, which are the COVID-19 response team at that various places, including at the county level. Go assess that house where you want to have a person undertaking the home-based care. Then you come and report. And the only people who should be under home-based care are people without any symptom, asymptomatic patients. Then that one is acceptable. Any patient, again, with any comorbidity, whether symptomatic or not, these are patients that must not be left at home. They must be in the hospital setup.
Although CAS Dr. Rashid Aman stated that those who cannot afford to be isolated in their houses because of space will be placed in a facility within the community that meets the recommendation for providing such care. His recommendations came after the World Health Organization said it was uncommon for an asymptomatic case to pass on the virus. Stephanie Sumba, Switch TV.